All right, so let's dive in. You might have heard the term prostatitis thrown around, maybe looked it up.
Hmm.
Today, we're really going to focus on, well, understanding what it actually is and, what the general treatment picture looks like.
Right.
We've got some info here. The idea is to just cut through the medical jargon a bit, to get a clear overview.
Exactly. Think of it like a quick primer, the essentials. Because at its core, prostatitis just means inflammation.
Inflammation.
Yeah, inflammation of the prostate gland, that walnut-sized gland. Sits just below the bladder. It's pretty important for male reproductive health.
Right.
So any kind of irritation or swelling there, that's what we're talking about. That can cause problems.
Okay, inflammation, we hear that word a lot.
Yeah.
So in this specific case, it's the prostate tissue itself getting, swollen, irritated.
Pretty much, yeah. That's the basic idea.
Now, I know our info here is sort of foundational, but it's probably worth mentioning. The whole world of prostatitis isn't quite that simple, is it?
No, that's a good point. It's not monolithic.
If we were really digging deep, you'd find different types, maybe based on cause or how long it lasts.
Absolutely. Yeah, there are different categories. Sometimes it's like a sudden bacterial infection. Other times it's more of a long-term thing, chronic.
Or on a co-cut.
And sometimes, interestingly, there isn't even a clear infection found. So those distinctions, they really matter.
Why is that? Does it change things?
Well, yeah, it can definitely influence the symptoms someone has and, crucially, how it's managed or treated.
Okay, so while we're keeping it broad today, knowing there are these nuances is important background.
Definitely. Context matters.
So what might actually, tip someone off? What are the common signs or symptoms that their body might send out?
Uh-huh. Well, typically the big clues involve discomfort, usually in the pelvic region.
Pelvic region, like where specifically?
It could be lower back pain, pain in the groin, or sometimes in that area between the scrotum and the rectum, perineum, technically.
Okay, discomfort there. Anything else?
Oh, yeah. Urinary changes are really common, too.
What?
Things like needing to go to the bathroom really often or feeling a sudden urgent need to go.
Urgency, right.
Sometimes pain or burning when urinating or even difficulty getting the stream started properly.
Mm.
And for some men, there can also be discomfort, after ejaculation.
Wow, okay. Those sound like they could be pretty disruptive to daily life.
They certainly can be, yeah.
So when it comes to actually doing something about it,
Mm.
tackling prostatitis, what are the general approaches? What's usually considered?
Well, a key first step is often trying to figure out if there's a bacterial infection causing the inflammation.
Okay, finding the cause.
Exactly.
Yeah.
Because if bacteria are identified, then antibiotics are usually, the main treatment, the go-to.
Right, clear the infection.
Clear the infection.
Yeah.
But for other types of prostatitis, maybe the non-bacterial ones or the chronic types, the focus shifts more towards just managing those symptoms.
Symptom relief.
Yeah, symptom relief and improving comfort. So that might mean using pain relievers, standard ones, or sometimes specific anti-inflammatory meds.
Makes sense.
And there are also medications called alpha blockers. They can help relax the muscles around the prostate and the bladder neck.
Oh, how does that help?
It can make urination easier, less difficult, address some of those urinary symptoms we mentioned.
I see. Anything else?
Sometimes physical therapy is recommended too, particularly for chronic pelvic pain aspects.
Okay, so quite a few potential tools in the toolbox, depending on the situation.
Exactly. It's about tailoring the approach.
Now, it feels really important to stress here. It's just an overview, right? Based on a general understanding.
Absolutely crucial.
If any of this is sounding familiar or you have concerns, this chat isn't medical advice.
No, definitely not.
Getting checked out by a doctor or healthcare professional, that's the essential step for a proper diagnosis and, a treatment plan that's right for you.
Precisely. Couldn't agree more. Our goal here is just to provide that sort of foundational understanding based on the initial question.
Right. So quick recap. Prostatitis, inflammation of the prostate.
Yep.
Can show up in different ways, different types exist.
Correct.
And treatment generally aims at either tackling infection, if it's there, or easing those various symptoms like pain and urinary issues.
That sums it up nicely, yeah. We've tried to take a focused look at a common issue, give you the core info.
Okay. And that brings us to maybe a final thought, something for listeners to chew on. Thinking about this basic picture of prostatitis, what kinds of things, maybe lifestyle factors or underlying health stuff, what might make someone more likely to develop it?
That's a great question. Risk factors.
Yeah. And also, what kind of research is happening? Like, what's being done to better understand how to manage this condition long term, especially those chronic forms?
Right. That really points towards the ongoing work in the field. There's still a lot being learned.
Definitely seems like an area with more to explore beyond just the basics we covered.
For sure. These questions highlight that perfectly.
Well, thanks for joining us for this deep dive today. We really appreciate you tuning in.
Yeah, thanks everyone.
We'll catch you next time.